So someone asked us to do a post on what to look for when looking for a therapist or a coach. And so we're working on some written content for that, but I wanted to kind of share some things on stories to contribute to that conversation. Now, there are a ton of counseling paradigms, so many. And this is really amazing because that means that there's something that fits well, we believe, for everyone. And it's not so much which paradigms are right, because so many of them are incredible and have so much to offer and so much truth. It's more so with where you're at in your season of life and your specific situation, which approach is best for you. And now, this not being your field, you might say, well, I don't know what's best for me. And so probably what would come before which paradigm is right is the person that I'm working with or potentially working with. Can I build rapport and safety with this person? Is this a person that I can find the therapeutic connection with, where safety will be kind of the foundation of the work that we do together? And that's going to depend so much on just so many variables that go into how to create safety with someone. The therapist would need to be a safe person and have done the work themselves to be able to be with people in all different situations and to be able to be safe for them. But a lot of these things you're not going to know until you sit down and chat with someone. So we always recommend that people have like a first consultation with someone to see if they think it's a good fit, and to not feel any pressure that if they meet with them and they're just like, yeah, of course, I'm not saying this isn't a great person doing great work, but doesn't feel like the right fit for me. We just love to empower people that you are the consumer. This is your inner work. This is your journey. This is your healing. You get to choose. You get to decide. And thankfully, there's so many incredible healers out there. You have options. And so that ability to build safety and cultivate safety with a client is vital. And actually, research has shown that outside of paradigms and the approach the counselor is using, that individual relationship with the therapist is actually the most therapeutic effect, which is really, really cool and totally fits with all that we know about interpersonal neurobiology, because that's how humans work. We find safety in the presence of another regulated human who gives co-regulation, and in that process, we're able to find healing on a brain-based level. So those are some thoughts. And then also, we really think it's important that the viewpoint of the therapist, the coach, is not pathologizing. So it's not that diagnoses don't hold a lot of value. We think that they can, actually. Some say no diagnoses. We think diagnoses can be really helpful and help show the framework within which you function, or your body has adapted to respond to the situation that you've been in. Genetics, all of the variables that come in to create a diagnosis in the body. We think that can be valuable. But if people are looked at through a pathologizing lens, it's really hard to do trauma healing work if they feel pathologized and broken. We think the lens of trauma adaptations, of what the body has done, what the mind and body has done to adapt to chronic stress and trauma, that is such a helpful paradigm and lens to look through. And we think no matter what modality you use, that should be there, that people should not feel pathologized for the normal responses to abnormal situations that they have been in. So that's really, really important for us and for you, we believe, because people should be trauma informed in that way, deeply, hopefully, and also abuse informed, because abuse intersects so much of our trauma stories, and to really understand the dynamics is crucial. So we'll have more content written on this soon, and you can continue the conversation from there.